Welcome dear students, I am Dr. Pratyusha and in this video let us learn in detail about stapedectomy. It is the mainstay of treatment in otosclerosis. So let us learn about it in more detail, its indications, contraindications, complications and also the procedure. Okay. Stapedectomy literally means removal of stapes, bone. It's performed in cases of otosclerosis. So let us see the indications for stapedectomy. First, the bone conduction of 0 to 25 decibels and air conduction of 45 to 65 decibels should be there. Anything lesser than that, a stapedectomy is not required. Hearing aids can be prescribed to the patient. Okay. So first is bone conduction loss should be 0 to 25 decibels and air conduction between 45 to 65 decibels. Then there should be an air-bone gap of at least 15 decibels. This is our second indication. And then the speech discrimination score must be 60% or above. Because speech discrimination score is affected in sensory neural type of hearing loss. In stapedectomy only addresses conductive type of hearing loss. Now let us see the procedure of stapedectomy. What exactly is done in stapedectomy? The first step is you will create a tympanomeatal flap, that is, an incision is given in the external auditory canal and the tympanic membrane is also elevated and we go into the middle ear. A tympanomeatal incision is given and a flap is created. Tympanomeatal flap is created. And this will show us way into the middle ear. And then what we do, our main area is stapes. So it has to be exposed first. Exposure of stapes. The next step is, because we are planning to remove the stapes, we first identify the incudostapedial joint and dislocate it. That is, separate the stapes from the incus bone. Incudostapedial joint is dislocated. Then on the stapes footplate, we create a hole in the area of otosclerosis. If we do that, it is called stapedotomy. If at all we remove the entire footplate of stapes, it is called as stapedectomy. Okay, is that clear? Either a hole is created or the entire footplate is removed. Hole is created in the stapes footplate. Which is called as stapedotomy. Or the entire footplate is removed. That is called as stapedectomy. But we cannot just remove the stapes and leave it like that, right? Instead of stapes, a prosthetic is placed. The prosthetic could be in the form of a Teflon or a stainless steel piston, okay? So, a prosthetic is placed in place of stapes. That looks like a hook, and on one side it is attached to the incus, and on the other side it is attached to the place where hole has been created, to the stapedotomy hole. That is the placement of piston. Either a titanium Teflon piston or a stainless steel piston, any of them are used. An appropriate prosthetic is selected. And finally, the tympanomeatal flap is closed. It is repositioned. Let me show you a picture of how the prosthetic looks like in place of stapes. So this is how a stapes prosthetic would look like. First, you can appreciate the normal picture. This is the tympanic membrane, and these are the three ossicles. This is malleus, and this is the incus with its long process to which the stapes is inserted. And this is the oval window of stapes. This is the normal structure. Now what we are doing is remove the stapes and put a prosthetic in its place, and this is how the prosthetic would look like. It has a hook by which it attaches to the long process of incus, and then a long process like this. And its long process is fitting nicely into the hole that we have created, into the stapedotomy hole. This is how it would look like, and it would perform the role similar to stapes. That is, it would, when the incus moves and transmits the sound into this prosthetic implant that we have placed, that would also vibrate and conduct the sound impulses. So this is about the process, the procedure of stapedectomy, and the last step is to close the incision. The tympanomeatal flap is repositioned. And the results of stapedectomy are very, very good. In patients of otosclerosis, this surgery has a good success rate. Okay, but can this be done on everybody? No, there are contraindications to stapedectomy, and let us look at the contraindications now. The first contraindication is it cannot be performed when it is the only hearing ear. Say there is otosclerosis in the right ear, and the left ear has a dead labyrinth, it is not hearing. Then we cannot perform stapedectomy in the right ear. Although otosclerosis is there and some hearing loss is there, we are not supposed to perform stapedectomy in such patient, because that is the only hearing ear. Okay, this is the first contraindication. Second, when there is associated Meniere's disease, then also stapedectomy is contraindicated. Now I told you on the clinical features, vertigo is one of the clinical features. Although it is not a common clinical feature, we have to keep in mind vertigo. In fact, we have to ask the patient if he has dizziness and vertigo episodes, because to rule out Meniere's disease. What happens in case of Meniere's disease if stapedectomy is done? There are more chances of sensory neural hearing loss after stapedectomy. Until now, only conductive hearing loss was there. Now, after you do stapedectomy, it will result in sensory neural type of hearing loss. So, in these patients also, the surgery is contraindicated. Next, it is contraindicated in small children. Why? Because they have recurrent eustachian tube dysfunction. You know that the anatomy of eustachian tube in children and adults is different. In children, it is more or less horizontal, and the function of eustachian tube is also not very good, because of various anatomical factors that we have already learnt about in eustachian tube disorders. So in children, what will happen is, because of eustachian tube dysfunction, frequently they suffer from repeated episodes of otitis media, and this repeated episodes of otitis media will displace the prosthetic that you have placed. This is one reason why you should avoid the surgery in children. And the second reason is that once otosclerosis has started, this focus will expand more and it progresses faster in children than in adults. So even if you perform the surgery once, later on there could be complete obliteration of oval window. Now in this entire process of stapedectomy, please understand that we are not addressing the primary cause of otosclerosis. There is nothing that we can do about the pathophysiology of otosclerosis. We cannot stop the conversion of this normal bone into spongiotic bone. We cannot do anything except that. Sodium fluoride might help, but there is no proper per se treatment for the exact disease process. We are only eliminating the diseased structure and putting an implant to do its role. So in children, even if you put an implant, the disease will continue to progress, and that too it happens in a faster rate and finally lead to obliteration of oval window. So for these two reasons, the surgery is contraindicated in children. But luckily, if you remember the age group of otosclerosis, it is usually 20 to 30. It is very, very rarely seen in small children. Okay. Next. It has to be avoided in certain groups of people such as professional athletes, divers, high construction workers, frequent air travelers, and people working in noisy surroundings. Why you should avoid the surgery in all of them? In divers and air travelers, in all these people, what will happen is there are more chances of post-operative vertigo and dizziness after this surgery. So this can interfere with their professional life. Because in air travel and diving, what happens is there are frequent changes, air pressure changes that will occur, and this can damage the hearing apparatus and also cause severe vertigo in such people. And in people who are construction workers and working in noisy surroundings, what will happen to them is after stapedectomy, they are more vulnerable to sensory neural hearing loss that occurs because of noise. That is noise-induced hearing loss. Stapedectomy makes them more vulnerable to noise-induced hearing loss, and so in them also this can be avoided. Construction workers, frequent air travelers, this also includes the aeroplane crew, okay? Divers, and also people working in noisy environment, as this surgery would make them more vulnerable to noise-induced hearing loss. And in air travelers and divers, it can increase the risk of vertigo and dizziness. Then, in people who are already suffering with otitis externa, tympanic membrane perforation, and some other external ear diseases, this is not an absolute contraindication, but first those factors have to be treated and addressed, and after treating them, stapedectomy can be performed. Okay. When there are other external ear diseases such as otitis externa, or if there is a tympanic membrane perforation or some external ear tumor, exostosis, in all these conditions, they are all relative contraindications. They have to be treated first and then it can be followed by stapedectomy. And also the surgery has to be avoided in pregnancy. Pregnancy can trigger otosclerosis and can worsen otosclerosis, but that is not the time to perform stapedectomy. Okay, so these are some of the contraindications of stapedectomy. Now let us look into complications of this surgery. There are multiple complications that can occur. First is when you are giving a tympanomeatal incision, there itself that can tear and cause perforation of tympanic membrane. It's quite common. If the incision is not given properly, instead of creating a flap nicely, there could be a complete tear. Okay? Tear of tympanomeatal flap and perforation of tympanic membrane. While doing the first step, this can happen. And then what you're doing, you're going into the middle ear area. So there you can damage any of the structures. Most important is you can damage and cause injury to cauda tympani nerve. Because cauda tympani is traveling in the middle ear cavity. It runs in the middle ear. So this cauda tympani nerve can be injured. And what happens if cauda tympani is injured? There will be taste disturbances. And suppose, imagine if the other side cauda tympani is also gone for some reason, then there will be severe taste disturbances to the patient. Okay? Then what are the other structures present in the middle ear? Ossicles are present and they can get dislocated. Dislocation of ear ossicles. More so, incus can get dislocated because that is exactly in the middle. Stapes, you are anyhow causing its dislocation. Incudostapedial joint, you are yourself dislocating. And even the joint between malleus and incus can get dislocated. Okay. Next, what are the other structures? Facial nerve is also one of the important structures present in the middle ear and that can get damaged. So, injury to facial nerve. Now, although cauda tympani is a branch of facial nerve itself, I am writing these two separately because injury to cauda tympani can occur more often and commonly than injury to facial nerve. Okay. Then, vertigo is possible in the patient. Postoperative vertigo can be seen. In the early post-op period, vertigo can occur because of some intraoperative trauma or because of serous labyrinthitis, or another reason is the prosthetic that we have put is not proper in size. All these reasons can lead to vertigo. In late stages, after many years of surgery, also vertigo can occur because of perilymph fistula and benign paroxysmal positional vertigo. The prosthesis that we have, the prosthetic that we have placed will definitely not be as good as the original Stapes footplate and it cannot close the opening completely. So it can lead to perilymph fistula very often. Fine. So vertigo can occur in the early post-op period because of trauma or because of serous labyrinthitis, and it can occur late in the course after the surgery because of perilymph fistula and also because of benign paroxysmal positional vertigo. Then another complication of this surgery is conductive type of hearing loss. Now we have performed the surgery to address conductive hearing loss, but this conductive hearing loss can still persist after surgery because of improper placement of the prosthetic. Either it is short prosthetic, or it is long and loose prosthetic, not exactly fitting into the stapedotomy hole, or displacement of prosthetic. That initial period is very sensitive after the surgery. Some vigorous movements can displace the prosthetic, or as we have earlier learnt in children also, repeated episodes of otitis media can also displace the prosthetic. And also erosion of incus bone can occur. And this can also lead to conductive hearing loss because we have dislocated the inculostapedial joint and we have hooked this prosthetic into the incus. Sometimes something might go wrong in this procedure and the incus can undergo erosion. And if at all the incus undergoes erosion, that will also lead to conductive type of hearing loss. Next, sensory neural hearing loss can also occur. Why? Because of some intraoperative trauma. Intraoperative trauma to the labyrinth or inflammation of the labyrinth, labyrinthitis, or because of perilymph fistula. Because of all these reasons, sensory neural hearing loss can also occur. Now you can understand that perilymph fistula or perilymph granuloma is a complication in itself. It can be a reason for conductive hearing loss and sensory neural hearing loss, and it is a complication in itself. Okay, and finally the last complication is a dead ear. That is, if the procedure goes badly wrong, the ear can become completely dead. This is the ultimate worst complication of stapedectomy, which usually does not occur. Okay. So these are all the complications of stapedectomy, and with this we complete learning about stapedectomy. Let me quickly revise it for you. First, what is stapedectomy and when is it done? It is removal of the stapes bone and it is done for the treatment of otosclerosis. It is the mainstay of treatment for otosclerosis. And the indications are conductive hearing loss between 45 to 65 decibels, sensory neural hearing loss between 0 to 25 decibels, airborne gap of at least 15 decibels, and speech discrimination score should be at least 60% or more than that. How do we perform the procedure? We make a tympanomeatal flap go into the middle ear, stapes is exposed, and then the inculostapedial joint is dislocated and a hole is created in the stapes footplate, or the entire stapes is removed, and in its place a prosthetic implant is kept and the tympanomeatal flap is repositioned. It is as simple as that. Then, what are the contraindications? First, it cannot be done if that is the only hearing ear. It cannot be done in people with Meniere's disease. It should not be done in people with certain occupations such as frequent air travelers, high construction workers, divers, and people who work in noisy environment. And then it should not be performed in pregnancy. And also if there are some other factors such as otitis externa or a perforated tympanic membrane or otitis media, they have to be addressed before performing stapedectomy. They are relative contraindications for stapedectomy. And what are the complications of stapedectomy? First, at the stage of tympanomeatal flap incision, that incision can result in a tear of that flap and cause perforation of tympanic membrane. Then we are going to the middle ear, so we can damage various structures present in the middle ear such as the cauda tympani nerve, facial nerve, middle ear ossicles, especially the incus. These structures can get damaged. And then conductive type of hearing loss can occur because of problems with the prosthetic such as a short prosthetic, loose prosthetic, dislocated prosthetic, and also later on because of incus erosion. All these can cause conductive type of hearing loss. Sensory neural hearing loss can also occur if there was some intraoperative trauma or labyrinthitis or perilymph fistula or granuloma. In some patients, vertigo can occur after this operation. In the immediate post-op period, if it occurs, it is because of some intraoperative trauma or serous labyrinthitis. And if at all this occurs many years later after the surgery, it could be because of perilymph fistula or benign paroxysmal positional vertigo. And finally, the worst complication that can occur is a dead ear. These are the various complications of stapedectomy. I hope the entire process of stapedectomy and its indications, contraindications, and complications are clear to all of you. Thank you very much and have a nice day.